Thank you, Mr. Morelli. The chair will recognize the gentleman from Indiana. Congressman, the time is yours.
Thank you, Mr. Chairman. Mr. Blaze, I wonder if you could speak for a moment about the effects that monopolies in the healthcare sector have on the overall cost of medical services.
Yeah, thanks for that question. I've actually done a lot of work in the state of Indiana on hospital prices there. Consolidation raises prices. It is clear. And consolidation has been growing. It's actually one of the things that we know has happened after the ACA was enacted between 2009 and 2014. Hospital consolidation increased, hospitals acquiring physician practices increased. When hospitals acquire physician practices, one of the problems is you get referrals within that hospital system without competition. It is a clear sort of evidence, agreement across health economics that consolidation significantly increases prices.
Can you quantify it? Is there an easy way to quantify what the share of healthcare price inflation is related to or explained by hospital monopolies?
You know, Congressman, it's not a particular data point that I'm familiar with. I think top of head within a local area, if hospitals merge, I think that leads to higher prices around 10 to 15%. I'm doing that off of sort of memory of some studies I've read.
You mentioned the efforts at the State House and in Indiana this year addressing some of these important issues, but what would be your recommendation at the federal level for members of Congress to address what's obviously a major driver of increased healthcare costs and hospital monopolies?
Yeah, so I think some of it could be antitrust policy. So, and I would, for a resource, in 2018, the Departments of HHS, Labor, and Treasury released a report called Reforming America's Healthcare System Through Choice and Competition that has 50 recommendations, allowing FTC to scrutinize the mergers of nonprofits. Right now, they're excluded from looking at nonprofits. Reversing the ACA's prohibition on physician-owned hospitals. Physician-owned hospitals can serve as a competition to traditional hospitals. Price transparency efforts, codifying price transparency so that consumers and employers are able to put more pressure and sort of bring greater sort of benefit design to their healthcare spending. And honestly, there's a lot of things that states do that are anti-competitive, where the federal government could look at trying to incentivize states to get rid of things. Probably the most insidious is something called certificate of need laws, where in order to expand healthcare in many states, you have to go before a board, a government board that's often dominated by incumbent providers, in order to bring on more hospital beds or expand MRI machines.
Can you unpack that a little bit further? If the federal government continues to ignore hospital monopolies and what it does to drive up overall healthcare costs on all American families, what can states do without actions of the federal government?
So states
you mentioned the con laws, but what else?
So states can make sure they don't enact these things called certificates of public advantage. And actually, some states have done this. And certificates of public advantage allow hospitals to escape federal antitrust scrutiny. And it's a move by a lot of hospitals. We've seen this actually in Indiana over the past year with a couple of hospitals there. They're trying to enact these. And I think things like expanded telehealth, expanded scope of practice can help lighten some of the problems caused by consolidation. But you're right to focus here. It's a real problem in American healthcare.
Yeah, thank you very much. I agree. Incredibly important and very helpful. Thank you very much, Mr. Chairman. I yield back.